Welcome to the Confident Clinician patient-facing resources. Today we're going to talk all about gout, and my guess is you're going to learn something new here. The research on how we educate patients around gout has changed a lot over the last couple of years. You probably are confused about what to eat if you have gout or at risk for gout, and we're going to settle all of that for you here today. I am Dr. Jordan Robertson. I'm a naturopathic doctor and I'm the CEO of A Confident Clinician, which is a practice resource for naturopathic doctors and integrative medical practitioners to help them stay evidence-based and up to date in their work with patients. This video goes along with our gout section, which helps educate patients around why they need to change their diet with gout and why everything they've probably heard about nutrition and gout is wrong. So welcome to our patient education series. Before we dive into what you need to eat with gout, I do want to call out a recent study that actually looked at the accuracy of YouTube videos and whether or not we are suggesting the right things for patients with gout. And they found that an astounding number of videos that are on the internet about nutrition for gout actually did not contain updated information. It contained flat out wrong information and was not in alignment with the current guidelines for what patients should be focusing on with respect to their nutrition. So buyer beware as you cruise the internet and look at other videos on gout. It's very common to come across things that are wrong. And why is that? The information around gout and nutrition has been conflicting for quite some time, and it's for a couple of reasons. We do know that patients who have gout have higher levels of uric acid. Uric acid is created in part by the breakdown of purines, which is like a protein in the body. And so we made an assumption at the time that if patients are at risk for gout, we should be eliminating those purines in their diet to help prevent a future gout flare. What this ignored was that most patients who have high uric acid actually are genetically wired to create more uric acid, and their diet really makes a very small dent in the amount of uric acid that's floating around in their bodies. And it also ignored the fact that patients who have gout are at risk for cardiovascular disease. And by decreasing the amount of purines, which comes from lean protein like chicken, we actually were worsening their diet quality overall. Patients who had things like high blood pressure or diabetes got very confused when we'd send them home with a pamphlet about gout that said to remove protein, because they also were going home with a pamphlet that said to reduce carbohydrates. And when we were making these recommendations for patients with gout, we were often worsening the rest of their health, worsening things like their diabetes, because as they lowered their protein, they increased their carbohydrates and fat intake, or we were just creating so much confusion that patients didn't change their diet at all. So in the past, we made recommendations to lower those purines, and now the research is very clear that we need to step back and look at patients' overall health and recommend a diet that's more in alignment with reducing cardiovascular disease than focusing on the minutia or the biochemical changes that happen when someone has a risk of gout. So what does nutrition for gout look like? And the thing to focus on here is that the inclusions are probably just as important or maybe more important than the exclusions. It's very common in integrative medicine that we focus on the foods to avoid, right? You leave your doctor's office or your naturopath's office with a long list of foods to get rid of out of your diet without a lot of discussion around the importance of including healthy foods. So when we talk about nutrition for gout, we actually want to focus on the foods we're including just as much as the couple of foods that maybe we want to decrease or exclude. So when we look at the principles of this gout diet, we're focusing on the DASH diet, which is a very common recommendation for cardiovascular disease, hypertension, and diabetes, because it focuses on lean proteins and high fruit and vegetable and complex carbohydrate intake. If you're overweight, your doctor may recommend weight loss, and we do see a reduction in gout flares when patients do focus on medically supervised weight loss. We also want to include and increase low-fat dairy as well as water. Now, there are a couple of foods at the top of that pyramid there that we do see when we decrease the intake of those foods in the diet, we actually do decrease the risk of future gout flares. The two major foods to decrease or avoid would be alcohol as well as high fructose corn syrup. So when we focus on a DASH diet intake, we're focusing on the overall diet pattern that's going to help decrease your risk of diabetes, heart disease, hypertension, as well as gout. So we watch patients who eat this pattern over time. We see they have less gout flares than their friends who are eating a different dietary pattern. So how do you incorporate those DASH diet principles? One, you're going to focus on eating vegetables, fruits, and whole grains. Okay, we want to increase the amount of antioxidants in the diet. This does help to improve your overall cardiovascular risk. We also want to include fat-free, low-fat dairy, high omega-3 fish. You may have heard to avoid seafood in patients who have gout, and that is accurate that lowering foods like shrimp and clams in the diet does seem to decrease the risk of a gout flare, but we don't want to do that at the expense of high omega-3 fish like salmon. We also want to increase low fat and lean proteins like poultry, beans, nuts, as well as including vegetable oils like olive oil. Where we want to limit or reduce is things like red meat, high saturated fat cuts of meat, and full fat dairy products. And of course, we mentioned already that those sugar sweetened beverages and high fructose corn syrup containing sweets should be minimized. This overall diet pattern, as you can see, is in a bit of a contrast to what we've talked about in the past with gout, where number 2 there, where we're talking about proteins, would be in question. But we know that by eliminating protein in the diet, we're probably doing overall harm to your nutrition pattern, and we would love for you to actually have a more cardiovascular focused nutrition pattern versus taking out individual foods like those proteins. So the evidence now is very clear that the recommendations for gout is the DASH diet. And I totally recognize that you probably have been confused in the past or have heard many other foods that need to be eliminated if you have gout. Remember that with nutrition, we have what's called the replacement effect. And when we take foods out of the diet, we're inadvertently increasing other foods. And sometimes the increase in those other foods is actually creating more harm and more damage than the foods that we tried to eliminate. And this is a perfect example of this. When patients left their doctor's office with a note that said, take out protein, one of two things happened. Either they increased their refined carbohydrates and fats, which was doing a detriment to their cardiovascular health, or they threw both pamphlets in the garbage, their diabetes pamphlet and their gout pamphlet, and never changed their diet at all. You are a whole complex person with lots of health things that we need to focus on and balance at one time. And the DASH diet actually does this beautifully for patients with gout. It decreases your risk of a gout flare, but it also helps decrease your risk of other cardiovascular morbidities and mortalities. And that's what we want to focus on, is your overall health and well-being and decreasing our risk of cardiovascular disease and, of course, prolonging life as long as possible.